Hi there, welcome to training session 2 in our ongoing series, Developing Trauma-Sensitive Classrooms. Before we start today, we want you to hear directly from Dr. Miracle. Here goes.
Hello, Marshall County staff. I am here to express to you our strong commitment, my strong commitment, and the strong commitment of the district to put in place these training modules that will help us to better address the growing need of our students to have supports with their social and emotional well-being. We know that that is something that is an increasing need among our students, both from the stresses and anxieties that they may experience or trauma that they may experience either in school or out of school. And we know that it's something that we will always have to have a continuous focus on maintaining and improving the service that we provide in taking care of that well-being for those students. So we have been fortunate enough to partner with REL App. We are in our second year of that partnership, in which they are working with us to help create these training modules. And we are excited that we are able to put these out. And hopefully it is a very useful resource for all of you moving forward through this school year. And we just want to reiterate how committed we are to doing this, not just for this year, but we're hoping that this is something that builds a lasting resource for us, as I said, to continue through next year and beyond, to continue to be in a position to always offer the best that we can for the needs of our students. Thank you.
Great, that was wonderful to hear. So let's look at the objectives for today's session. School staff will increase their understanding of what trauma screening is and is not, the importance of screening students for their experiences and the effects of trauma, and how to communicate the benefits of screening and its results. So we also want to just note that this training is based on selected literature and from resources and trainings that were developed by REL Appalachia back in 2020 and 2021. When you see the icon on screen here, it's a tip for you to pause the recording and reflect on the questions in the handout that you have. We will point you to specific questions that are most relevant to the information on the slide presented. So now we'll get started. Hannah, over to you.
Thank you, Victoria. So let's start with a definition of screening and a brief comparison between a screening process and an assessment process. I will clarify what each process typically includes and doesn't include, who is typically qualified to conduct the screening and assessment processes, and how educators and mental health providers typically use the information from each process. Both trauma screening and assessment processes help educators and mental health providers identify children's and families' needs early and tailor services to meet those needs. The processes differ in the breadth and depth of the inquiry and the credentials required to administer them. Trauma screeners use brief measures to assess a wide range of experiences and identify common reaction to trauma and common but not all symptoms of trauma. With proper training and support, teachers and other school staff, including paraprofessionals, can administer a screening and deliver results and follow-up support. Trauma assessment, on the other hand, is a more comprehensive and tailored process administered by a licensed clinician. The ideal assessment would include a combination of different types of measures and strategies for collecting information from the student, all caregivers, at least one teacher, and other relevant professionals in the student's life about the student's trauma history, traumatic stress symptoms, and family environment. While assessing problems and difficulties a child is experiencing, it is important to consider the child's strengths, talents, abilities, sources of emotional support, and capacity for resilience. For the remainder of this training, we will be focusing on trauma screening processes, why it is important to screen students for experiences and effects of trauma, and how to identify students who need more intensive trauma-sensitive support. We are focusing on screening for a couple reasons. One, as school staff, you are better positioned to administer screening processes, not assessments, which require licensed professionals. And two, typically screening is a precursor to and a less intensive and intrusive process than conducting a comprehensive mental health assessment. Now that we have shared a definition and developed a common understanding of the scope of trauma screening, let's talk about why having screening processes in place at your school is so important. Although the prevalence of trauma in the US is incredibly high, many parents, caregivers, teachers, and other caring adults are often unaware of a student's trauma history or traumatic stress. Without screening, that is explicitly asking students about their experiences and effects of trauma, many students will suffer in silence because they may be reluctant to talk about it. While most students can recover with the support of caring adults, many children who experience ongoing traumatic stress are not identified and do not receive the trauma-sensitive services that can help them recover. Trauma screening is a crucial first step in helping students exposed to trauma and their families recover from trauma exposure and its effect. Many screening measures are feasible to implement and can be completed in fewer than 10 minutes and can be administered by paraprofessionals without a clinical background, as long as they have training and support. And while you might be concerned that asking students about their traumatic experiences may be upsetting to them, it is usually not. Rather, most respondents appreciate the experience. Rarely, when students do experience mild or moderate distress during screening, it is usually temporary and can be greatly reduced by helping the student feel safe and supported. Screening can also help to identify needs for supports early before problems worsen and require more intensive services. With identification, students and families can receive information and get appropriate support to reduce future trauma experiences and recover. Trauma is treatable, and trauma-sensitive evidence-based treatments are becoming increasingly available. We invite you to pause the recording and reflect on question 1 in the reflection handout. I will now turn it over to Mariana.
Thank you, Hannah. In this next section, we're going to walk through what we should be screening for and data that we might look to in addition to some of the formal screeners. So as a reminder, in handout 2, we've seen the common symptoms of trauma and how they can manifest in a variety of ways, physically, cognitively, in terms of social and emotional reactions, language, communication, and even how children learn. Students can respond to trauma in different ways, or they may not exhibit any of these symptoms at all. It's a very personal reaction. In fact, symptoms of trauma may not even be observable to educators or family members, or they may be visible to some and not others. I'd invite you to think for a moment about some of the students that you've had in your experiences and the types of symptoms that they may exhibit. Could it be that the root of some of those behaviors was trauma? It's possible. So these are some of the symptoms that we should look out for when we are screening for trauma, but always be mindful that there may be others. So first, what should we be screening for? The Substance Abuse and Mental Health Services Administration defines trauma in terms of 3 E's: events, experiences of those events, and the adverse effects of the events. So the events are those actual or even threats of violence, harm, or neglect that occur as single or repeated events over time. An event is a very specific thing. But a specific event can be experienced as traumatic by one individual, but not another, based on how they assign meaning or how they are affected by it. And the meaning of those events can vary from individual to individual. based on their age, their race, their culture, their gender, developmental level, history of trauma, level of support available, and other factors. All these things influence how we experience trauma. Think about your own childhood. Something may have occurred at school, in your family, or the community that deeply affected you, but maybe it didn't affect other people. Maybe your understanding and your perspective and your emotional experience of the event were different from other people around you. Those events influence how we respond to those potentially traumatic events over time. Similarly, these factors combined influence the effects of trauma, whether they occur immediately or delayed, whether they are short-term or long-term, and whether they are perceived as linked to the trauma at all, because we know that some people may not see the connection between their emotional reactions and what's occurred. So therefore, trauma screening should measure a wide variety of experiences and common symptoms of trauma effects to adequately identify individuals who are likely to experience traumatic stress. In addition, school-level teams can use screening measures along with other school-collected data, such as curriculum-based measures of reading, math, and writing, office discipline referrals, attendance patterns, and community events to inform decisions about students' needs for more trauma-sensitive supports. Such data, when available, may provide additional information to help identify students who may be experiencing traumatic stress that impairs their ability to function or affects their behaviors, as well as students' strengths and needs related to trauma and resiliency. Remembering the ABCs, academics, behavior, and community, can help. Let's consider briefly some of the data that may be available to educators that suggest when further screening or assessment or assistance may be warranted. How students are performing academically, especially if there is a change in their performance, can be a red flag that something is wrong. Have they recently shown a decrease in engagement? Their homework's just not done when maybe they used to have it in on time, or their performance on tests is beginning to slide. Has their behavior worsened? Do they arrive late, request visits with the nurse, or get into trouble? Or maybe this was a student who was always actively engaged, and now they're withdrawn and quiet. Are you aware of events in the community or in their family that may flag concern, such as an act of violence, or a change in placement or housing, or something that's happened in the larger community? We invite you now to pause the recording to reflect on question 2 in the reflection handout. And now I'll turn it back to Victoria.
Great. Thank you, Mariana. So now you might be asking yourself, how can I best communicate about the benefits of trauma screening and the results? So let's dive in. There are many potential benefits for students and for their families when schools implement a systematic trauma screening process. First, students usually, remember as we said before, appreciate the experience of feeling heard and understood. They may have previously been reluctant to reveal their trauma experiences or the effects, but once asked in a private and focused way, most students open up. And honestly, they reveal information about what has happened to them. So the routine administration of screenings can also help to normalize, if you'll allow us to use that term, to normalize and then reduce the stigma of discussing and dealing with trauma. By introducing the screening process to students and their families, educators have the opportunity to provide information about trauma its effects, and the many support and treatment options that are now available to help people recover and heal. This can lead to students being more willing to engage and participate in strategies that are going to help them learn important coping and communication skills. It can also lead to families developing better communication skills with their children and with the school about their families and their students' needs and their recovery process. Systematic trauma screening also benefits the entire school community. Routine and systematic screening for trauma can unearth issues early and then possibly even before they become serious problems, when less intensive strategies and interventions can provide relief and healing. Screening results often provide educators with insights about their students' functioning and their behavior. So how they perform daily tasks, communicate, study and learn, make and enjoy friendships, particularly students who may demonstrate internalizing behaviors such as withdrawal, isolation, or even something like emotional numbness. So it may offer educators formerly confused or even frustrated with the student's behavior that aha moment. So that then changes the focus from what is wrong with that student to what happened to that student and how can I help? As we said before, introducing the screening process provides opportunities to discuss trauma, its effects, and its recovery options with both students and families when appropriate. Further, the screening process and results may open the door to reducing future traumatic exposure if the right follow-up steps are taken to develop a plan and provide ongoing support that's tailored to the students and families' strengths, needs, and culture. But we also cannot ignore some common challenges to conducting routine screening for trauma efficiently, accurately, and in culturally appropriate ways. Fortunately, most of the challenges can be overcome with sufficient planning and preparation. Many educators are not sure how to select and use the right measure to screen students both quickly and reliably. It can feel resource intensive, if I may use that term, to inform students and parents about the screening procedures, then obtain their consent and students' assent, and conduct screenings in appropriate settings that offer privacy, yet efficiently screen large numbers of students. Most importantly, districts and schools must be able to act on the information that the screening provides, offering students and their families the information and support that they need to learn about and to then recover from trauma at a level that is sufficient and appropriate. In the next section, we're going to share with you some important considerations as you develop and implement a trauma screening process that will work in your local context. So before we go there, we're going to invite you to stop the recording and answer questions 3 and 4 on handout 1. So stop now. You see the icon. Okay, welcome back. So I want to end with an uplifting and important message. You'll see on screen the uplift principles. We want you to keep these in mind as you plan, prepare for, and conduct, and then ultimately communicate around the trauma screening process. It's critical to remember that screening is often the first contact between students, families, and educators, or even the school mental health provider. And students and families form their first impression during this process. So how that screening is conducted can be as important as the information that you gather. because it sets the tone of your trauma sensitivity, the services and support options that can be offered, and then begins the relationship with the student and family on that journey toward healing and recovery. These uplift principles, as you see on screen, are principles of an effective, responsive, culturally appropriate screening process to create trust and an emotionally safe environment and to collect accurate screening results. So I encourage you to take a deep look at the first three principles shared here. So they encourage educators to be culturally sensitive, well prepared, attentive to privacy, and validating when they start a screening process with students and their families. Furthermore, screening procedures should always define the steps to take after a positive or a negative screening. And we must remember that even negative screens do not necessarily mean that a student doesn't have symptoms that warrant further assessment, further support, or additional services. It's important for the screening process to include time to communicate with other educators, students, and families, where appropriate, where permissible, about the results, and to offer follow-up support options. The last three principles shown here, again, these uplift principles, reflect these very ideas. Your school and district would have a screening process in place and should have a clearly delineated process for providing immediate support and for referring students for more intensive supports. And all school staff should be aware of the steps to make such a referral. Most importantly, referrals should be made for services that are culturally appropriate while addressing barriers to accessing these services. Barriers might be things like transportation, language, childcare issues. In these sensitive situations, it can have such an impact on your ongoing relationships with your students and their families. It's so important to meet the family where they are. Each family has a unique history and repertoire of coping and healing, and experiences and beliefs that shape how they will respond to offers of mental health support. We suggest you pause the recording again now and review these principles, thinking about how educators can demonstrate their cultural responsivity and respect when screening students about their trauma experiences and offering options for support. So you can stop now and answer questions 5 and 6 on your handout. So thank you again. I'm going to refer now to Hannah Cheever, who will wrap things up for us today. Hannah?
Thank you so much, Victoria and Mariana, for walking us through these approaches and important principles. To close, we want to remind you that the next step in this series is for you to implement or start planning the process to implement some of the strategies introduced in this video to identify students who may need more intensive trauma-sensitive supports. As you implement these strategies, consider your school-specific context. As you begin to implement them, you will receive support from school trauma teams. We hope you found this presentation to be useful. If you have any questions, please feel free to reach out to your school trauma team.